All right, everyone. It is 11 o'clock, so I will go ahead and get us started. I am Taylor Post, Swiftland's office manager, and I would like to welcome you all to today's webinar, Coronavirus, Hoaxes, Fear, and the Truth, How Libraries Can Help. And today's presenter, Dr. Stephanie Rollins. Dr. Stephanie Rollins is a research and writing specialist at the Air University Press at Maxwell Air Force Base. She is also an adjunct professor for the University of Alabama and teaches digital reference, collection development, and organization of information, among other courses. Stephanie serves on both regional and state library committees, and she has 23 years of experience in academic and special libraries. She holds a BA in English from Auburn University, a master's degree in library service, and a doctorate in public administration, both from the University of Alabama. Please welcome Stephanie and enjoy her webinar this morning. Stephanie?
Thank you, Taylor. Good morning, Deb. Thank you for being here as well. Good morning, everyone. First of all, I just want to check on you and make sure that everybody is okay. Everybody's safe and healthy. I was laying in bed about a week ago thinking about the coronavirus and, kind of feeling overwhelmed and a little bit panicky and thinking about, well, what could I do to fix this for myself and how could I help other people? And one of the best ways that I know to fight fear, whether it's in my personal, professional life, is to fight fear with facts. And that's one of the things that we can try to get around with this topic is how can we find the facts so that we can fight our fears? And how do we do that? And how do we help our patrons find this information so they can also ease their fears? So that's kind of the plan for today. The specific agenda I'm going to talk to you about in a second. But if you would, please get out a sheet of, is this a little bit better, Colleen? If you would, please get out a sheet of scratch paper. We're going to use that later. And please know that although I am a doctor, I'm not a medical doctor or a psychologist. So this advice is things that I've discovered, things that I found that I thought would be helpful to librarians. So please know that. But what I am is an information expert. So if it changed, okay, so the volume is not so good. Let me see if I can adjust this just a little bit. Okay, is that better? Okay, great, fantastic. Okay, so again, I am a librarian and information expert, and I do know about facts and how to find facts, as you guys do as well. So this may be a review for some people, but I just want to make sure we're on the same page. I've tried to update this as I've gone along, as the new news has come out and different things like that. Today's agenda, let me show that to you. We're going to talk about, what is this coronavirus? It's got a bunch of different names. It's got SARS-2, CoV, it's COVID ID. So we'll talk a little bit about that, what it is. What are some of the hoaxes that exist? There is some automated help that you can point your patrons to. Why should we focus on the truth about this and why us? Some basic terminology about verification and fact-checking. How we can debunk this false information, because not everything's automated, right? And we have to look at our skills that we have that we can share and teach to our patrons. What sources we can use to help our libraries prepare. That includes some webinars that are coming up from different organizations. How can we market our services? I mean, we're closed, right? Most of us. And what form should that take? And how can we make our patrons know that we're still available to them? This is no different than every day. We've got all these resources that we can help them with, but what might this look like and how can we market and still stay connected? And then what are throughout this, I'm going to point you to some trusted resources that you can use, that you can point your patrons to, your family, for further information. So let's go ahead and get started. So what is COVID-19? I didn't know this until a few weeks ago. My background is not medical, but the coronavirus is actually a whole series of viruses. And it's called corona because if you look at it under the microscope, it looks like a crown. And so this was a new, and they sometimes call it novel, because it was a brand new form of this coronavirus. And it's basically a respiratory illness. You guys probably know all these facts, but I'm just going to review them very quickly. It's close contact. It spreads through droplets between people that are within 6 feet of each other. Some of the symptoms are fever, cough, and shortness of breath. And there are a lot of preventatory measures that you can do. We'll talk a little bit about that too. Probably repeat myself a little bit. But 6 feet apart, stay away from people that are sick, wash your hands, different things like that. And there's not a vaccine right now, but they are working on things. And there's not really a treatment, but again, they're working as fast as they can. And for me in Alabama, and I don't know about you guys in Florida, but we have a ton of pollen. So at this time of the year, it can be really confusing. Do you have allergies? Do you have the flu, which is also going around? No thanks, flu, with the coronavirus. Again, but with the coronavirus, you have a fever, dry cough, and you have a noticeable shortness of breath. And the thing about it is you don't often know you have it until 2 to 14 days after. If you are feeling bad, call your doctor. Don't just show up. And there's also a 24/7 call center for the Florida Health Department. So if that's something that you want to call and talk to somebody about, you can. So this is just something you can point to people. There's a ton of videos out there. This was done by John Hopkins, and I felt like it was one of the best videos that kind of explained it. She's very calm. She doesn't use a lot of medical jargon. So if you wanted to point somebody to it, it would be a good source for you. Of course, some of the symptoms, again, we talked about fever, cough, shortness of breath. Again, some ways you can stop the spread of the germs. And I'm not trying to repeat myself. What I did want to do here was show you that the CDC has some very colorful, easy to read graphics that you could share with your patrons, possibly on social media. Again, you don't want to overwhelm your patrons with information as well, but I thought these were great because they were super simple and easy to read and kind of got the facts out there. So I encourage you to explore the CDC website. Some terminology. I'm going to paste something in the chat box. There's a term that I just discovered. Give me just a second, and I will paste that in there. And it also lists states that are doing this. So one of the terms that it's not new or anything, but I just didn't find it before I updated my presentation yesterday. But there's this term called shelter in place, and basically it means that you don't leave the house except for essential tasks of groceries or going to the doctor. And so it's got lists of states that are doing that. My state is not yet, and from what I understand, Florida isn't, except some of the counties are. So it tells you kind of what shelter in place is, and also states that are doing quarantine. So I thought that was useful information. Okay, some other terms are social distancing, and that's where you're deliberately increasing the space between people at least 6 feet to avoid spreading the illness. It also includes things like working from home, closing schools, online classes, visiting people on devices like FaceTime or Zoom, canceling large meetings, things like that. And so we've seen a lot of that recently. Also, we've got people that are kind of voluntarily doing that, staying home, different things like that. Now, self-quarantine, what that means you're exposed, but you're kind of worried that you might have it, but you're not showing symptoms. And usually people do that for at least 14 days, whether you're ill or not. And there's people that are voluntarily doing this, even though they haven't been exposed. They're just trying to keep things safe. Isolation is exactly what it means. It means you're confirmed or showing symptoms, and you kind of put yourself in quarantine, and you don't share towels. You perform proper hygiene. You don't want to make anybody else sick. And then flattening the curve, there's some question now as to whether or not we're actually doing this. And this is a very simple, kind of broken down explanation graphic of flattening the curve. Basically, it's using protective practice to slow the rate of COVID-19. So what it means is if you do protective measures, wash your hands, self-isolate, social distancing, with these protective measures, you can not overwhelm the healthcare system capacity. And I think that's what we saw in Italy, is people didn't pursue a lot of these protective measures, and so the healthcare system got overwhelmed. So with flattening the curve, every person can help flatten the curve if they follow all the CDC guidelines. We're not going to, not have deaths. We're not going to not have people get sick, but everybody can do their part to make that happen. Okay, so these are the numbers I'm sorry, I had one more thing I was going to say. So if you're around a military base, there's some terminology there. I work for out on the Air Force Base at Maxwell Air Force Base in Alabama, which is near Montgomery. And so we have some health protection measures. And so we're now, right now, at HPCon Charlie. So it's Alpha, Beta, Charlie, Delta. You'll see A, B, C, D. And so we're currently at ThreatCon Charlie. And so that's useful for you to know if you hear that term in the news or any of these terms in the news. We could go to HPCon, which is health protection measures, could be going to D at some point. I hope not. But it just tells you, so there's a high morbidity epidemic or contamination, substantial social distance, limit meetings, TDYs, shelter in place indoors, or if, as directed, don respirators, mass distribution of medical countermeasures if applicable. So you guys can read that as well. But just some terminology from the military, and there's some Department of Defense sites you can go to as well. Okay. I don't know if you saw these new guidelines from President Trump. They pretty much mirror the CDC, but he's advocating, trying to kind of shelter in place, stay home for 15 days. So if that happens for you, what does that mean? I just wanted to look up for you guys in case you needed this. Hopefully things won't go this way. But, what kind of things did you need for a possible self-quarantine? And even though the shelves look pretty empty, we really only need, according to the experts, we only need about 14 days supply of food per person. You also need other home essentials, toilet paper, which will come back at some point, not immediately. I did check a lot of the FDA websites, CDC, Department of Defense to answer all my little questions about food and different things that I was worried about. And the sites I'm going to point you to have answered every single one of my questions. And we're not going to run out of food. We're not going to, the supply chain is not broken. It's just slow to come back. So we will have that. And talking about food, make sure you have some of your comfort things too. Chocolate, some people like wine, depending on what it is. So other home essentials, toilet paper, different things like that. Your prescription items, you want to have at least a 30-day supply. And also non-prescription, like your over-the-counter allergy, cold medicine that's going to, if you do get a cold during this time, make sure that you have some of that. Also, a thermometer. I realized the other day our thermometer was broken, and I could not find, with my research skills, I could not find a thermometer anywhere. I found one on Amazon for $14.99, and that's coming soon. And I may not need it, but I just realized our thermometer wasn't working. So, put together those non-RX items as well. First aid kits, Band-Aids and things like that. Bottled water if you need it, but our water supply in America is great. Maybe different if you have some sort of water issues in your county, but they say it's really not necessary to stockpile water. Copies of your health records, entertainment, screen time or not screen time, board games, exercise, things that can entertain you. A plan for your pets. What are you going to do if your pets get sick? And then also, you could think about family care. I have older parents, what's the plan for them? And this is no different. These are things, I don't think about all the time, but things that I should have in place regardless of what's going on. Just because the world is different these days and you want to be prepared. So that's just a little bit. Oh, thank you, Barrett. I went to Walgreens and they didn't have any and we asked. So it was just the strangest thing. There was a huge blank spot. So anyways, if you guys are looking, ask behind the desk at CVS. Thank you for that tip. So those are just some things about preparing if things, do come to this quarantine level or shelter in place, things that you want to think about being prepared for. Also, I had some questions about food. It's not a concern with takeout. This is a site you can look at and read about food. They say it's very unlikely. And if you do ingest coronavirus, it's going to be processed through your stomach. So, I do have these questions just like everybody else. And again, the facts are only going to help you. Okay, so now for the overwhelming statistics. These are facts. However, this is as of yesterday about lunchtime. And I'm going to show you live. And there's also a site for Florida where you can get statistics. But take these with a grain of salt. They are numbers. However, if you looked at the news this morning, the U.S. is the number one in terms of cases. And thinking about that, put it in perspective because we now have testing widely available, which we didn't have before. So more, of course, more cases are going to come out. It is spreading. That's a fact. But think about when you look at statistics. Don't get overwhelmed. This is all the information that we have. And so think about that, your skills as a librarian, and kind of look at it and pick it apart. Look at the total recovered versus the total deaths. Not that it's not, I'm not saying that not to discount that, but really take a look at the numbers and kind of analyze them. Because if you just look at 510,000, that's very overwhelming, right? So take that apart. So that's for the world. And then we also have some numbers for the US. And then I'm going to show you Florida specific, and you can actually look at counties, and it's interactive. So give me just a second. I'm going to share my screen. Hopefully this will pick up pretty quick, and I'll be right back. Okay, looks like it's picked up. Hopefully we're back. Okay, awesome. So again, this is the world. Okay, and you can click on the different countries. You can zoom in. This may take a second to kind of catch up with me. You can actually click on the United States. So you may live in Florida, but you want to look at other parts of the United States, you can do that. For instance, if I wanted to look at Arkansas, and I can look at each county, it's going to tell me how many are confirmed for each county. So you can kind of look at that, and it gives you some statistics. For Florida, it's got even more detail. Give me just a second for this to catch up. And so you can actually click on each county. Anybody want to type in the chat box, and I'll look up your county real quick. First one gets it. But you can actually, zoom in and look at it. People are typing. Okay, so Lee County is first, and I'll do another one too just to show you. But you can scroll down here over on the right, slowly catching up. And Lee County has, and this is updated at 11 a.m. and 6 p.m. every day. So if you want to come back here. And again, I think this is based on some of the data from Johns Hopkins that I showed you earlier, but it does seem to be updated pretty well. And so if you see for Lee County, got 66 total cases, 61 are residents, 5 are non-residents, 3 deaths, 23 hospitalizations. It gives you some age breakdown, some gender, whether or not it was travel related, things like that. So Hillsborough, let me go back here, go up a little bit. Here's Hillsborough, and you can see this right there. And it's also going to give you that same information. 151 cases, 1 death, and some different information about gender and age. And like I said, this is updated twice a day. I think it's also gives you some information down here about Florida testing, counties, and then you can also look at the USA and the world down here. Slow to catch up, just a second. So some useful information. And one of the things that I liked about this, again, the data is open to interpretation, right? Because we're getting it so fast. People could and could not have been tested, so it may be underrepresented. We're not 100% sure. But again, in the US, see if this will pick up, we have over 86,000, over 1,300 deaths. And if you're looking for total recovered numbers, 753 might seem low compared to the death count, but those are still coming in because first of all, it takes 2 weeks to know that you have the virus, and then it also takes a couple weeks to recover. So those numbers are going to continue to rise. The other thing I wanted to show you before we go back to the PowerPoint, all this information is coming from the World Health Organization. And what I wanted to show you is they have situation reports. And so these are updated every day. And that's where a lot of this data comes from. But there's also media resources. And this is where you can get a lot of fantastic handouts that you can post directly on your website. It's also got some travel advice, information for doctors and partners. So some fantastic information there you can share with your patrons. Also, the CDC has a situation report. It's, again, fantastic. Again, they have an entire media library. It's very simply written, no medical jargon, very fantastic for your patrons. And again, they've got a situation summary. And this map, if you click, it's going to take you to the Florida Department of Health or whatever Department of Health is there. But again, it's also got information on cases in the US. It's got a situation summary. And this is updated by 4 o'clock, the day before reporting. So you can see this is not 100% updated, looks like. Okay, so I'm going to go back to my PowerPoint. Give me just a second. I'll be right back. Okay, so that's a way to get some of the statistics and facts. And like I said, put those in perspective because we don't have all the answers with these statistics. So again, those were the situation reports from the WHO and the CDC. And so again, these are some sites you can go to that I feel are trusted. I've looked at them. So again, we've got CDC, WHO, also the National Institute of Health. I didn't show you that, but they've got a fantastic guide. And they can also provide information to the National Library of Medicine to support your researchers right now, because there are still, library researchers that are medical that are looking for this information. And there's ways you can get help from the NLM. Also, Johns Hopkins, those are the ones that provided those fantastic maps. The Food and Drug Administration, again, if you have any questions about food or drugs or anything like that, any question. Of course, the Florida Department of Health. And then the U.S. Department of Defense, they've got some information as well. That graphic I shared with you. And then Google and Facebook, I don't know if you've noticed when you've gone to those, but they have some fantastic integration with the CDC and the WHO. Facebook has an information center, very quick updates, people asking for help also, and also Google. If you do a search in Google for coronavirus, it's basically a template, and it's got the coronavirus to the CDC, the WHO, different things like that. So they've really done a great partnership on that to provide information for where basically people look first, right? Also, Twitter, I know, has got some stuff too. Okay, remember I asked you to take out that piece of paper real quickly? Just take 20 seconds, and you can also type in the chat box if you feel like you want to share. I know not everybody wants to share their fears. I'm going to share mine with you, just to kind of show you what I'm thinking. Yes, this PowerPoint will be shared after. Oh, I didn't look at Bing. I'm going to make a note of that and see what they have as well, and I'll list that. Thank you. So list some of your fears about COVID-19. What are some of your fears on that scratch sheet of paper I asked you to pull out? And I'm going to wait a second. Looks like multiple people are typing. So I'll share my fears with you as well. There's a link here to a TED, a series of videos about overcoming your fears that might be helpful. Yeah, not knowing if you have it or not, absolutely. The number skyrocketing out of control, family members getting sick, absolutely running out of supplies. My older parents, definitely, Julie, I'm in the same boat. Yes. Oh, she works in a grocery store. Mutating to a more severe illness. Yes. And those are all things we can find out about if we do a little bit of research. Oh, wow. The dry cough, that, your daughter's pregnant. And they did say that that was low. I did see some research that said that if the effect on pregnant women was low. I'd have to back that up with some facts for you. But yeah, my grandmother is 93 and she's got an underlying condition as well. Right, absolutely. Like I have a cough and my throat hurts, and do I have it? And so again, look back at the symptoms, and you can always talk to your doctor. Losing family. So just to share some of my fears with you, and I could be illogical or not, it just depends. But this is John Candy. You guys might recognize this. That the world is completely closed. We're completely stuck at home, and we can't even go outside. And that's not going to happen. I mean, we might be not be able to go to except for essential places, but that's not going to happen. We're going to run out of food. Like I said before, the FDA says there's no shortage of supplies. It's just there's a shortage of stocking. Of course, The Walking Dead is in the back of my head. That's not going to happen. But, again, like I said, these fears might be illogical. And again, I'm going to get sick. My family members are going to get sick. My friends. I worry about those things. Right. Linda, my son and his girlfriend both work for restaurants, and my daughter-in-law is a cake decorator, and so there's no weddings. So yeah, not enough hospital beds. These are all, fears that people have. Thank you for sharing. So I'm going to talk a little bit, not making light of this situation, but one of the first things that I thought about was having gratitude for what I have. And I'm not talking down to anybody at all. But my daughter-in-law sent me this picture. This is my grandson. And one of the first things that they did was they went outside and he's sniffing the flowers. Take time to stop and smell the flowers. It's not a real flower, but he doesn't know that. So thinking about things like that. And they do say, Monica, that it's a low impact on children. There's some facts on that too. But yeah, just again, facts can help us kind of put it in perspective. Not that we don't have fears, but put it in perspective can help. Things that we can do to kind of mitigate this. Limit your time on social media. Some people are social media junkies. I had to just kind of limit my time because a lot of times the worst case scenarios make it into the news. We don't have a lot of positive articles, right? So limit your time. And then also, we'll talk about this in a little bit, but visit the most trusted sites. Again, know the facts. That's in red because that's one thing I have control over. Create a new routine. Working from home, I'm so blessed. I mean, I am so lucky that I can work from home. But you have to adjust your routine for that, right? You have to make sure you still get your work done and that you're still communicating with people and you take time for yourself as well. Go for a walk. You have to think about how to redo things. And if you're homeschooling your kids and you're working, my hat is off to you. That's really hard. But you still have to create a new routine. Occupy your mind with some relaxing hobbies. What got us into the profession? If you're like me, it's a great book. Fall into a book. Distraction is great for this, and not watching the news all the time, or play the piano, or a board game, or paint. All those different things. Also, if you want to go online, there's all these courses and all kinds of things. I'm going to post some Facebook groups later. I don't post tons of sites for you guys to go to, but there's like 12 museums and this and that. So instead, I've posted some Facebook groups you can go to where people are posting all these sites. So if you're alone, call, text, video, chat with a friend or family member. And if you have severe anxiety, seek help from a specialist. Again, I'm not a psychologist. These are just things I think that would be helpful. And again, I love this quote. This is our lives as librarians, right? There's a ton of information out there. The challenge is trying to determine which information is accurate. And so again, in times like this, and any time, find a few sources you trust and stick with them. Again, limit the frequency of your updates. You don't have to know every single detail. And think about social media self-discipline. Maybe uninstall the apps that pop up with notifications every 5 seconds, right? Know when to walk away. Think about, you don't have to have every detail every second. Name your fears. We just did that, right? We just named our fears. And think about whether or not your fear is realistic. And for you, it might be. There's no judgment here. You feel what you feel. You're allowed to feel that. And think outside of yourself. Like with me, how can I help others? I can do this presentation for Swiftland. I can deliver groceries to somebody who's sick. I can pick up medication. I'm a key spouse, which means I help with a squadron out at the base. And so all those spouses, all the families, if they need help, they can call upon me. Also, there's things you can do virtually. I think the Library of Congress is asking for people to transcribe documents. There's all kinds of things you can do. Always pay attention to yourself and your family. If you don't take care of yourself first, it's really hard to take care of your family. Make sure you sleep, get proper nutrition, get outside as much as possible at a safe distance from people, engage in physical activity, practice yoga or meditation. I'm horrible at meditating, but you could do that. Center your routine and awareness. Keep your mind from wandering down some dark, unknown paths. It's really hard when you see the news 24/7 if you have it on all the time. The key is to work towards understanding fears and putting them in context. And like I said, one of the best ways to do that is with facts. And also, don't chastise yourself or anybody else for worrying. Your feelings are valid, and you're allowed to worry. But again, put it in perspective, and think about ways that you can help with this. And then my last thing, I'm going to take literally just 30 seconds, and that scratch piece of paper I asked you to get out. What I want you to do is take it, put a line down the center, draw a line down the center of the paper, and on one side, put things I can't control, and on the other side, put things I can control. So things you can't control the spread of the virus, right? But you can control your prevention measures. We just talked about some things you can do to control the panic. And this is not new to me. This is what my husband says to me all the time because I get overwhelmed easily. It's just, I'm an emotional person. I can't help it. I'm empathetic, emotional. I feel things. And so he says, what can you control about this situation? And so, again, I can limit my exposure to social media. I can keep in contact with family that I'm worried about. All those things. I can practice prevention measures. So if you don't have time to do this right now, think about doing it later because it's naming your fears and putting them in perspective. And it's just a really, really quick exercise you can do or you can share with your patrons, with your family. So hopefully this is something, if nothing else, that will help you personally. There's also a disaster distress helpline, and this is done by the I can never say this right, the Human Health and Services Department of the government. I may have gotten that wrong, sorry. But they can definitely help you if you need to talk to somebody for free. Absolutely, Barrett. There's a ton of meditation apps. There's yoga for free on YouTube. Again, I just want to talk very quickly about reasons not to panic. We don't see a lot of really, like, here's the great news about coronavirus. There's just not a ton of those articles. There's a few out there, but not many. And so if you need facts to kind of help you not to panic, here's some things that may help you. There is a first rapid test that's in the works. There's the relief bill that's, as we speak, being debated in the House about the corona relief bill. And Italy and China's cases, and not deaths necessarily, but cases are slowing. So those are things that are in the news, and I'll continue to update this. But we know what it is. It took a couple years to identify that the HIV with the virus of HIV virus with AIDS. We know what this is. We've known since about the 31st of December. We know what it is. There has been a test for it since the 13th of January. The situation is improving in China. The number of cases diagnosed is decreasing. There are 80% of the cases are mild. And so that if you do your math, that means that 14% are severe pneumonia and 5% critical or fatal. So it's it's something to think about. People recover. The symptoms appear mild in children, 3% in people under 20, and the mortality under 40 is 0.2%. Let's see, somebody just typed something looks like important in the chat box. Let me see. Okay, yeah, I'll get to that in a little bit. Okay, so again, the virus can be wiped clean. Science is on it globally. There have been 184 articles that have been published. There are 8 projects seeking vaccines. And there are at least 80 clinical trials underway. So this is, some things to think about, some good news to think about. And I'm not trying to downplay, and say, hey, if you just take care of yourself and, you look at the facts, everything's going to be fine. I have cautious optimism, but I am going to remain vigilant, like most people. And I like this quote by Martin Luther King. He says, today our very survival depends on your ability to stay awake, to adjust to new ideas, to remain vigilant, and to face the challenge of change. and I think it stands true today with coronavirus. So I just want to share a couple of hoaxes with you. Snopes has a whole section on the hoaxes about the coronavirus and fact checking. I'm going to show you that in a second, but I want to show you a couple other sites first. I'm going to go live with the Snopes one because I want to show you how much they have. There's also All Sides, which gives you the perspective from the left, the center, and the right on different things that are in the news politically, something that you can go to. There is a site called factcheck.org. Again, it looks at some of the political information and fact checks it for you, the things that are in the news about politics. The World Health Organization, each one of these icons, there's about 20 different mythbusters that the World Health Organization puts out. And they have things like, taking a hot bath does not prevent the new coronavirus disease. And each one of these images you can download and use as a graphic. And the things like spraying alcohol all over your body can kill the coronavirus. No, it's not going to help. So different things here that you can actually use and put on your website or send to your patrons, different things like that. PolitiFact, what they do is they also have some facts, and they have what's called a pants on fire setting, which means, liar, liar, pants on fire. So there are, this is one that says there is no coronavirus 19 virus. And it's on Facebook, and each one of these it goes into and tells you about it. So for instance, if your time is short, it just gives you the basic facts. You can also click for more information, and it'll go really deep into the actual news story. Other things like YouTube, the coronavirus was invented and patented in the USA and then planted in China. I don't know if you've heard that one. There's some different things that they actually check, and you can kind of dive into those. Another one is NewsGuard. What they're doing is they're gathering all of the websites that are publishing false coronavirus information, so you can be aware of those. Pointner also has a website that it's got a database that's checking some facts. For instance, holding your breath can test for COVID-19. That's false. They've also rated things as misleading. Like the malaria drug is a cure for COVID-19, can be misleading. And they also use different sites. So you'll see AFP, France Info, Maltida.es. And I wanted to show you AFP. They're also a news source, and they do a lot of fact checking on their stories. Again, you have to look at every article. That's just how it is. But they've got some different facts that you can check. I had heard this one right here, where gargling warm water with salt or vinegar kills COVID-19. I had heard that somewhere. I don't remember where. And can you hear me? Okay. All right. So this was a claim on Facebook, and when I did this presentation a couple days ago, somebody's dentist had told them that. Interesting, right? So this is a graphic that's been shared, and yes, it might help with your sore throat, but it's not going to kill COVID-19. And so AFP is another place you can do fact checking. Okay, another one I just saw in the news is that, and this is helpful to know because people are scared of this. People are scared that the National Guard's going to come in and it's going to be like a military state where you can't leave your house, you can't even go outside. So the Pentagon is also trying to spread, trying to help with this misinformation and conspiracy theories. There's no mass quarantines in the United States. And so they're going to set up a Mythbusters site, and once I find that, I'll share it. It's people need to stop this rumor that there's going to be a police quarantine of Americas. And this is from the National Guard Chief of the Air Force, General Joseph Lengyel. That's something to think about. And let me share my screen. I just want to show you Snopes really quickly, because I think it's again, you still have to look at every article yourself, but it's got a great kind of summary of some of the most different categories that I've seen in one place. Give me just 1 second, and I'll be right back. Okay, so this is Snopes, and what I like about it is they have all these, going to catch up in a second, all these different categories. Origins and spread, prevention and treatments, all these facts that people have tried to push as being real. So I'm going to click on prevention and treatments, and if you want to come back and look at this later, you can. Snopes is free. They do want people to sponsor them always. People want help, but there's some different things here. Will sipping water every 15 minutes prevent a coronavirus infection? No holding your breath. Again, that's out there somewhere. So these are all false. Can a cattle vaccine be used to fight COVID-19? No. No, a hairdryer won't stop coronavirus. Here's again the one about will gargling with salt, water, or vinegar eliminate the coronavirus? And again, you can click on these, and what it will do, in just a second, hopefully you can see this. Let me scroll down a little bit. Let me make this smaller so you can see it. And it gives you the origin of the article. It gives you, here's the facts. And this is actually one of those images from the World Health Organization. So just really quickly, I wanted to show you that. Let me stop sharing my screen. I'll be right back. Okay, so one of the best things that we can do for this information is, like I said earlier, know the facts, but also share the facts. Anybody can get sick. I think I just saw on the news this morning, Boris Johnson has it. Prince Charles has it. So it doesn't discriminate based on, ethnicity or gender or anything like that. And this is from the CDC. So they know what they're talking about. Within reason. It also says that for most people, the risk of becoming seriously ill is thought to be low. Older adults and people with underlying conditions, of course, again, protect yourselves, social isolate, do the best that you can. Someone who has completed quarantine does not pose a risk of infection for other people. Again, we've talked already about the things that you can do to keep yourself healthy. And again, knowing the facts, knowing the symptoms are only going to help you with preventing it and flattening the curve. So these are some of the sites that we went to. Again, you'll get this in the slides. Okay, so we went through some automated things, and those are fantastic on the coronavirus or even just for everyday issues that you're looking to verify. But not everything's automated, right? So Hemingway says that every man, and I put in librarian here, should have a built-in automatic crap detector operating inside him. And I believe most librarians do. We are detectives, right? We know how to find things. And so I just want to go through quickly a couple of terms. Verification and fact-checking. Those are things that we do. This is our science. This is how we get facts and we get the right facts. Fake news. It's been hot topic for librarians. It's been a hot topic for the world, for politics. Somebody's raised their hand. If they have a question, let me know. Type it in the chat box. Okay, I don't see anybody, so we'll keep going. So what is fake news? In case you aren't sick to death of what this is, false news stories, or they can be misleading, or it could be something people want you to click on so that you'll buy something perhaps. Sometimes it's satire or it's a joke. So it's something that we need to be careful of, especially in times like this where people are spreading things that are fake or misleading or cause fear. And this isn't new. We've seen this throughout history, as early as Octavian and Mark Antony, to the latest thing with Pizzagate, the politics and the voting with Russia and Facebook. I mean, all kinds of things are out there. So it's not anything new. Some terms you want to think about: clickbait. People get you to click on things to encourage you to click on a website. There's disinformation. There's something called confirmation bias, where you seek out things that support what you already think, which is similar to a filter bubble. A filter bubble is a little bit different, though, because what happens is when you log into Facebook, or even if you search Google, they present things to you that you're used to seeing. And so you kind of get insulated. So it's really important to look for other sources of news to balance out what you're seeing, because it's automated. You don't even realize it. Also, hoaxes, we talked a little bit about, fake news, misinformation, disinformation. We've talked a little bit about those as well already. So why us? Quickly, if you have a chance, type in the chat box, why are we the ones who are on the front lines of fighting for this information? Why are we? And why us? Multiple people are typing. So as you're typing, I'm going to check the chat box. Yes, information, finding information, absolutely. And we know how to evaluate it, and we can teach people how to evaluate information. We can counter, the fakeness with media literacy. So many people trust us, right? We deal with the public, and we can reach out to so many people. And we can also partner with local, state, and national organizations to help. We're also advocates for skepticism. Again, you've got that built in. I mean, ever since I started, well, that's an article. Really? Where'd they get their information from? Very skeptical. Right, and people know that that's who we go to. We also have tons of materials that we can provide on social media, research guides, LibGuides, if you haven't heard of those. We do classes, we have hands-on activities to help people approach the truth. And this is a graphic that kind of hit home for me. Oh, Riva, my parents, all they watch is Fox, and I'm not judging anybody if you watch Fox. Please don't think that. But you have to balance it out, and they have Fox on all the time, and so it can scare you if you have it on all the time. And they're not, definitely, I don't think they're as balanced as other places. And again, some of the things I'm going to talk to you about in a second can help people discern if that's true or not. But this was an image from a graph from the Pew Research Center. 89% of people get news from either news websites, apps, or social media. And so that's a staggering fact. So we need to be out there educating people. And about 1 in 4 of them report sharing fabricated news, whether they're aware of it or not. And so that's why I think we keep seeing this rise in information. And with the coronavirus, it seems to be even more prevalent in times of crisis. It seems to be that the misinformation is even more out there. And why should we care? Who cares, right? I care. You care. People deserve the truth. It can destroy your credibility. It can hurt people, especially in a time like now when it's a crisis. People. I think I just saw a couple days ago on the news where there was an ingredient in a couple's aquarium. I may have gotten this wrong. An aquarium. Something or other, and somebody took it because they saw on the news that a malaria drug could help prevent the coronavirus. And so there's all kinds of things out there. And so if we can just help our patrons get better educated about how to evaluate information, the truth can only benefit them. Okay, another study, just very quickly. This is done in 2016 of 7,800 middle school, high school, and college students. And they say that people can't recognize what is the political bias of social message, and they're duped by sponsored content. So again, we're in the perfect spot to help people in normal times, and especially now in times of crisis. I'm going to run through this really quickly. These are some ways to evaluate the news when or facts. It's not automated. One of my favorites, I'm going to show you that one, is this one called Escape Junk News. And these are things we've always done. We've looked at the evidence. Do the facts hold up? Who's the source? Who made this, and can I trust them? What's the context of this? Who's the intended audience? What's the purpose? Why was this made? Was it made for satire? different things like that. And how is this information presented? These are all things that you can check. This is kind of done for kids. All this information, you can get the graphics and everything for free. So it's a fantastic thing. This is more of an academic library. It's called the CRAP test worksheet. Same things, currency, relevance, authority. These are questions that you can ask and actually give it a score. And so it's just, again, another way of looking at it. One that I wanted to, that was a little bit different for me, because I'm also kind of in the editing and writing field as well as the research field, was this verification handbook. And it's for media and journalists, but it talks about how to verify digital content for emergency coverage. And so it's a fantastic way to kind of verify news, another avenue for you guys to look at. But with epidemics, there's things you need to look at, and look at what's the basics of the disease. We've looked at that already. Be wary of claims about the epidemic source. Verify images and videos. I'm going to talk through that real quickly. Double check case numbers. We talked about that. How can you really verify the statistics? It's just the best information available right now. Be aware of attempts to downplay, or on the other hand, blow the disease out of perspective. Don't share prevention or treatment methods without consulting official resources. And I wish that couple had done so, because I think one of them died, which is really sad. And then look for what's still unknown. It's still new. We're still learning more about it. And so avoid falling for alternative explanations. There's scams out there too, so be wary of that. So this is a media bias chart, and you can take it for what it's worth. It's not, it's someone's organization that kind of ranks the news. I like it. They've done a lot of work. It doesn't mean that it's perfect by any means. But if you look at the top, you can see like some of the mainstream news and the things that have original fact reporting. So these are some of the news sites. I'm going to expand it a little bit. So you can see Fox is not on here. If you do look for Fox, it's like way down here on the bottom, all the way over to the right, I believe. But some of the news sites that I go to, AP, NPR. I'm going to talk you through some of those. So these are some of the sites that I could go to. And remember, we talked about earlier, find a few trusted news sites and stick with them. So AP News, NPR, Time, ABC News, the Washington Post, New York Times. Now, that does not mean that they are right all the time. You still have to evaluate the article itself by some of those tips that I talked about. Yeah, okay, great. Shortwave. I'll put that on my list. Thank you. So, again, don't have the news on all the time, and think about things to look at. Real quickly, I just want to show you. These are some strategies for actually checking the domain of a website, so you can see if they own a ton of name servers, may not be such a great site, whereas CNN has these sites, and you can kind of see exactly what they are. So it kind of helps you to know if the website's real or not. Also, anybody can make a fake Twitter post. You'll see the one I made up there. It's a screenshot, so you can tell that that's already fake. But you can be anybody you want to be online. So is the person posting the information about coronavirus real? Things you can look at to check that. So I list some things here. LinkedIn is great for professional. You can, again, anybody can fake anything, right? But it's going to give you a little bit more information. So here's some sites. This WebMe, and this is outside of Google. You can always Google someone. But WebMe was a little bit different presentation, and so this is the link if you want to look me up. I was kind of impressed by some of the stuff I found. PQ, you can also just do white pages, and it'll take you to a certain level, and they'll want you to pay, but you can still get a lot of really good information. LinkedIn, I got all this information about me, and I didn't even log in or have an account. So it gives you a ton of information. People in times like this can also fake the weather and a location. So this is a couple of images. The first one is, I said that I posted this on Facebook, claiming to be in Birmingham, Alabama on January 28th, 2014. And then this, that I had to spend the night in the library. And then from my window, I can see the mountains. And so two ways you can check that is Weather Underground has a history, and there's also Google Earth. And so, yes, I did spend the night in the library. You can see here, this is the Weather Underground History map, and it shows you precipitation. And then Google Earth, this is false. There's no mountains in Wetumpka, pretty flat. There's also ways to check images and videos. You can look at Veracity, Google Reverse Image Search, and TinyEye. TinyEye I love because you can drag and drop an image, and it'll tell you the latest ones. I'll show you that real quick. And then Amnesty International YouTube Data Viewer. I'll show you that in a second real quick too. So these are some places to check images. You can just upload the image and it will try to look to see where that image came from. Same thing for Google Reverse Image. And then, like I said, TinyEye. And what I like about that is you can sort by the oldest. So you can see this picture of Michelle Obama actually came from BBC and it had nothing to do with immigrants. Also, the Amnesty International, it separates the video into little clips. And so it shows you that there's no bear chasing this girl when she's skiing. So real quick, what kind of things would you do to find this guy, this doctor who's is considered an expert in the microbiology field? What kind of things would you do to check? And you can type in the chat box. I know we've got professional directories. We've got, you can look at Google, of course, look up his degree, absolutely. Yes, Barrett, you will have access to this information. And one of the first things you might do is actually look at that picture and reverse image it. If you do, you'll see it's a stock photo of a lonely man in church. So anyways, just so you know, these are some sites for about fake news, LibGuides, and different things you can look at. So what I want to get to in our last like 5 or 6 minutes is how libraries can prepare. And I actually just want to show you some sites live. There's a list of them here. And let's see. So there's some sites for helping libraries prepare. There's also some Facebook groups that I talked about. Library Think Tank, Libraries are Champions of Healthy Communities. Libraries and social media, they're talking about how to kind of do outreach. And I want to show you, again, some of these in just a second. And then Sanity Matters, Activities and Advice. Remember I said people are posting things about the Hallmark Channel. I saw that in the chat. That was fantastic. But there's a ton of everybody's posting this stuff. And so it'd be easier maybe to go to a Facebook group and look at people posting sites instead of, trying to find all of them in one place. There's some resources for academic and school libraries. There's also some ways for you to talk to kids about the coronavirus. Some videos, different things like that. There's also, so preparing libraries is first, right? How do you prepare? There's also guides out there of how to present information on coronavirus. So this section talks about, there's a Google Docs list of all the LibGuides that people are putting together on coronavirus. You can also do a search for guides in the LibGuides community. And it's going to pull back different things based on type of library, whether it's public, academics, hospital library, and you can look at those. So you don't have to reinvent the wheel. Learning librarians, fantastic. I'll add that to my list. Also, more guides, or if you just have a blog, you can just post a couple articles. There's some examples here. And just real quickly, and I'm going to show you a couple sites in Florida that have done a great job with this. You want to look at how could you still offer services in a time like this. And so what some libraries are doing is they are doing streaming story time. Librarians are going online on the YouTube, on Instagram, on Facebook, on YouTube, different places, and still offering services like they're live. You can offer live webinars like Swiftland's doing. We have all of our remote resources, right? Just need to remind people. I think they forget sometimes. You could have a virtual tea. Take advantage of the Florida Electronic Library. That's there for everybody in the state. So things that, we just need to remind people, or have a, book club, do a live Facebook Live book club. There's all kinds of things that you can do. And so I'm going to show you those and all those sites in just a second. But, again, how can you provide service? We're great at providing information. Here's information about the coronavirus, but how can we still keep people connected in times like this? So let me share my screen real quick, and I just want to take you through a couple of those sources. So this is a guide for public libraries. And again, I've tried to provide sites that have a bunch of sites listed under them, so it's more like a hub. So this is advice and online resources for public libraries. Again, it points to a lot of the same things we've talked about. Pandemic preparedness, this is from the Public Library Association. How to prepare if you haven't already done so. Most people are prepared at this point. Some news, different things from the Public Library Association, some sites that can help. There's PLO resources on the pandemic, some free webinars, and I've got some training listed for you at the end. I'll show you that. This is a couple of sites that I've listed for you, and this is more under preparing. This is things that libraries have done for other libraries, like how to offer library support, remote library services. Make a video about how to access the digital library if you're blocked, like you said, Emily. So maybe there's a way you could get that captioned as well, or it would have a closed caption if you could record it on YouTube and then just put it on your Facebook page or something like that. But it's got resources for how do you do this for Oregon libraries, and it might also help Florida libraries. This is a different one. Somebody just mentioned this to Luli the other day, and they've got like how to serve library users during quarantine, but they also had a site. They had a site under theirs about how to reopen. What do you have to do when you want to reopen your library? And I've got that listed on the PowerPoint. Another source, show you real quick. This is for academic libraries, and so how do you continue to function? How do you teach? Again, there's a ton of publication and webinars that might be helpful. One of the fantastic resource. Again, we're talking about lists of trying to find things to do for people and for schools and for adults. This is a Google Doc that you can go to, and it's got all of the free educational resources here. And not just for kids, also for adults, for homeschooling, for different things like that. So again, I want to link you to stuff that has a list of sites and not just do 50 million sites for you. Remember I mentioned LibGuides? So you can actually, it's going to load, it's going to take a second. So here you can actually type in the word coronavirus. You can see I've done that. And you can say, let me click on search. And so these are all research guides. So again, if you're trying to provide a guide on coronavirus, these are sites that have already done it for you. And so there's 2450 academic institutions, special libraries, public libraries. So again, you can limit it by that. So I want to switch now to some of the Florida libraries and how they're responding, not just providing information, but providing services. And I think that's kind of the gap right now is, again, like I said, we're real good at providing information, but how can we keep people connected? And so this is the University of Central Florida Library. And these are things you might want to think about. This is very simple. This just says academic resources during the COVID-19 situation. And they've provided services, and they just kind of give you an overview, very quick, very, very nice, very simple. So not just information about it, but how can you get help during this time? Another one I want to show you, Hillsborough, I know you're here. They've done a fantastic job. So visit the library from home, learning and fun for all ages, open 24/7 for you. So again, that idea of providing services. And then lastly, I wanted to show you kind of a special library. This is the Borland Library through the University of Florida. Our doors are closed, but our services, continue. So they've provided COVID-19 resources, but they're also talking about how you can still get help. And I think that's so important right now. So one last thing I want to talk to you about, I'm going to switch back to my PowerPoint. I know we're a little bit over 4 minutes. Sorry, I know your time is valuable. But let me stop sharing and I'll come back and share my last little bit that I have with you. Because there is some training going on right now. Of course, Swiftland is going to do this a couple more times, so if somebody's missed out on this, you definitely can mention this to them. And I know Taylor's probably going to tell you the next date when we finish. But real quickly, so there's some other sites that do a fantastic job of, saying, hey, we're here, we can still help. And again, it's just a reminder. We've always had these things, but it's just a reminder to people who might be, experiencing some panic. How can they still use the library? So there's some training available. The WHO has training. There's some public libraries, successful ways to work remotely, coronavirus frauds and scams. There was somebody just on the news who was selling pills and injections, and he was arrested. I think it was an FBI investigation. I don't know if anybody saw that story this morning. Managing stress and anxiety in the public library. Innovative solutions in times of crisis. So those are some that are upcoming, and then there's a ton that they just had that are recorded or being recorded. And let me get to the end here because I have a list on Google Drive, which I need to update because I want to see if there's anything else. But there's things about managing strategies and stress. That one was just yesterday recorded, and that's available. How to combat COVID-19 related misinformation. That's kind of some of what we did today. I wish I had stolen this title, Know and Go, Don't Stand So Close to Me. So there's some recorded things that, if you have time, you might want to come back and look at. How librarians respond to coronavirus and other pandemics. Copyright issues is something I hadn't even thought about. College is responding. And so let me just grab this real quick so you can get this Google Drive if you do want to sign up for training, because I know that a lot of this is filling up fast. So let me post this in the chat box for you. And this is a list that you can get to. So lastly, how do we move forward? And I know that that it's overwhelming. Stress and anxiety, like Leslie says, is overwhelming right now. The best advice I can give you is know the facts. Again, limit your time that you are exposed. I look at newsletters and things once a day. I check the stats once a night, and that way it doesn't make me feel so overwhelmed and anxious. Not that I'm trying to downplay it, but I think that just helps my mental state. And so what can we do? We can do what we've always done, have cautious optimism. I know it's really hard right now. Use the strategies to kind of sift through this information. Know that we don't have all the facts, but we can do our best with them. Fact check, automated places like Snopes, or using the strategies that we kind of have always known about, checking out an article or a book or a person. Consider multiple reliable sources, not just one. Get outside your filter bubble. Be skeptical. I think this is just kind of built in with us now. Verify as much as we can, and then share what we know without overwhelming people, right? Have that skepticism. And so hopefully at some point our libraries can reopen and everything will be okay. I don't think we've seen the worst of it, but I'm hoping that some of the things that we've talked about today and some of the things I've shared have eased your anxiety a little bit. Some exercises, some ways to check facts, some ways to think about putting things in perspective. I hope that this has helped you. Please feel free to contact me. This is my email. I'm happy to stay and answer any questions. If I can't find the answers, I will get back to you. Thank you so much. I'm sorry we're about 10 minutes over. But again, hopefully this has helped you and given you some sites, if nothing else, some ways to kind of cope and feel a little bit better about things. We can't control it, right? So focus on what you can control. And I hope that everybody stays safe and healthy. And again, if there's anything I can do to help you,
Thank you,
please don't
Dr. Rollins,
hesitate to
for an
contact me.
informative
Thank you so
webinar.
much for coming today.
Attendees, if you enjoyed this webinar, we have one final coronavirus webinar scheduled for April 1st, as the March 30th is full, with Dr. Stephanie Rollins, and has 5 seats available. After that, you'll be placed on a waiting list. As always, we encourage you to keep an eye on the Swiftland CE calendar, the Swiftland Facebook page, or your message from the listserv. Thank you, everyone, for attending, and have a great rest of your day. Thank you, Stephanie. Thank you, Deb.